Welcome to Specialist Chronic Care Nursing Practice. My name is Dr. Olivia Hollingdrake and I'm a lecturer here at the School of Nursing. I'm a registered nurse and my background is in cancer care, and I've also cared for people living with inherited bleeding disorders such as haemophilia and people living with HIV and hepatitis C. And over the 20 years of my practice, conditions like cancer and HIV have evolved from life-limiting conditions to ones that people now live with for long-term, years and decades. And I've also seen in my practice the rise of conditions like diabetes and heart disease. So chronic care nursing is becoming increasingly important, and including seeking ways to enhance self-management and promote quality of life in the long term. That's really where my research is also focused. Firstly, with quantitative research, looking at how to support self-management among men living with haemophilia here in Queensland. And then more recently, a qualitative study looking at social support networks of people living with HIV, and looking at ways to harness those networks to support self-management and contribute to quality of life. So I do understand the complexity of chronic care and the ways that we as nurses, we must consider factors that exist beyond treatment of physical health, and actually take into account social and emotional complexities that contribute to the way people experience chronic disease and the care that they need. Up until a few months ago, when I started working full-time here at QUT, I worked in an outpatient setting at the Royal Brisbane Women's Hospital. I'm really interested in finding out about you and your practice settings, and your interests, the types of people that you provide care for in your nursing roles, and also your goals for the future, because I hope those are the things that will inform the way you approach your learning in this unit, and that we can learn from each other. Those of you that have completed NSN 007, Contemporary Issues in Chronic Care Nursing, you will have developed a good understanding of the issues facing people living with a chronic condition, including prevention and supporting self-management. In this unit, we focus on multi-morbidity, so the complexities of providing care for the growing numbers of people living with 2, 3, 4 or more different health conditions. The unit consists of 3 modules. The first module runs from week 1 to 4 and introduces multi-morbidity. It looks at the reasons why diseases occur together, but also the impact of having multiple chronic conditions. So not just the physical impacts, but also the social and emotional aspects that are important to people in their everyday lives. Module 2 is also 4 weeks long, and that covers symptoms and symptom management. And it really considers the common symptoms that people living with multi-morbidity tend to experience. Just before we get into that though, we'll first talk about strengths and the importance of putting the whole person at the forefront of our nursing interventions, rather than just considering people as the sum of their various symptoms. Module 3 looks at integrated models of care for people living with complex multi-morbidity. And the ways that we as nurses can become collaborative leaders within the health service environments where we work. So in this way, we ensure that people living with multi-morbidity get the comprehensive and person-centred care that they need. So it is a complex picture, but with focus on key principles that underpin what we do, we can become those collaborative leaders. So to complement the modules, I'll be delivering 3 seminars, and they're normally face-to-face here on campus and recorded, but they're going to be online via Zoom this semester. In these seminars, I will talk about the assessments as well. There are 2 written assessments for this unit, both in essay format, and I'll also discuss these more in some subsequent short videos. I hope you enjoy the unit. It's my first time teaching it, so please give me feedback along the way. Anytime you need to, please feel free to contact me via email, ask me questions. We can set up a time to talk on the phone or in person. Fill me in on what's happening on the ground for you, because I'm here to support your learning and ensure you get the most out of this unit and at your time at QUT. So welcome.